Okay, let's talk about something that affects hundreds of thousands of people every single year: dangerous blood clots. In this explainer, we're going to break down exactly how they form, how doctors find them, and what we can do to fight back. And if you want to know just how big of a deal this is, just look at that number. In the United States alone, up to 180,000 deaths a year are because of a complication from these clots called a pulmonary embolism, or PE. That is a huge, huge number, and it really drives home how serious this is. And this gets to one of the biggest challenges for doctors. A pulmonary embolism is often called the Great Masquerader. And why is that? Well, it's because the symptoms are so vague. They can look like a dozen other illnesses, which makes it incredibly tough to pin down. So let's pull back the curtain on this medical threat. We'll start with what it actually is and why it's such a massive health concern. The official name for this whole process is venous thromboembolism, or VTE for short. Think of it as a two-part story. First, you have the creation of a clot in a deep vein, usually in the leg. That's a deep venous thrombosis, or DVT. Then, part two is the really life-threatening part, when a piece of that clot breaks off, travels through the bloodstream, and gets stuck in the lungs. That's the pulmonary embolism. And check this out, because this is a really worrying trend. You might think clots are just a problem for older folks, but since 2007, the death rate from PE has actually been going up among younger and middle-aged adults here in the US. That's a huge red flag that this isn't just an issue for the elderly. So how do these dangerous clots even form in the first place? It's not just random bad luck. There's actually a pretty well-understood recipe for disaster. You know, doctors have this concept they've used for over a century called Virchow's triad. It's basically the perfect storm for a blood clot. It's a combo of three things: blood flow that's too slow, blood that's naturally more sticky or prone to clotting, and some kind of damage to the wall of the vein. When you get those three things together, you've got a really high-risk situation. The easiest way to think about it: imagine a massive traffic jam, but inside your veins. The slow blood flow, that's stasis, is like traffic grinding to a halt. The hypercoagulability, or sticky blood, is like having way too many cars on the road, making a jam almost guaranteed. And the injury to the vein? That's like damage to the road itself, creating the perfect spot for a blockage. And this is the really crucial part. The things that can cause this, they're super common. We're not talking about some rare, exotic disease. We're talking about risk factors that are part of everyday life for a lot of people. Things like being sedentary, obesity, having major surgery, or even dealing with inflammatory conditions like pneumonia. The list of potential causes is just huge. We saw a perfect and frankly terrifying example of this during the COVID-19 pandemic. The virus was a nightmare for creating clots because it basically hit all three parts of Virchow's triad at once. It caused massive inflammation, it made platelets extra sticky, and it damaged blood vessel walls. Okay, so we know how they form, but how on earth do doctors find them, especially when they're so good at hiding and looking like other things? Well, the first clues are the symptoms, and they are totally different depending on where that clot is. If it's a DVT still in the leg, you might get a Charlie horse that just won't quit, along with swelling and tenderness. But if that clot has traveled to the lungs and become a PE, the symptoms change completely to things like sudden shortness of breath, chest pain, or even passing out. From there, doctors have a clear game plan. They don't just guess. They start by calculating the probability of a clot using a special scoring system. And based on that score, they'll move on to specific blood tests, and then, only if they need to, they'll order imaging to get a final confirmation. A key tool here is a blood test called the D-dimer. Now, it's really important to understand that this is what we call a rule-out test. If the D-dimer comes back negative, it's very, very unlikely you have a clot. This is great because it helps doctors avoid ordering expensive imaging scans for a lot of people who don't need them. And here's a really smart little clinical trick they use to make this test even better for patients over 50. Instead of one cutoff value for everyone, they can adjust it based on age. They just multiply the patient's age by 10. So for a 70-year-old, the new cutoff becomes 700 instead of 500. It's a simple tweak that really helps reduce false alarms. All right, so if the risk is high or the D-dimer is positive, it's time to get a picture and actually see the clot. For a DVT in the leg, they'll use an ultrasound. The technician basically pushes on the vein. If it doesn't compress, there's a clot inside. For a PE in the lungs, the go-to test is a special kind of CT scan that makes the clot light up on the screen. So, a clot has been found. Now what? Is it all bad news? Absolutely not. This is where the story gets much more hopeful, because when VTE is caught, it's very, very treatable. The cornerstone of treatment is anticoagulation. You probably know these as blood thinners. Now, key point here is that their main job isn't to dissolve the clot that's already there. Their goal is to stop that clot from getting any bigger and, this is crucial, to prevent any new clots from forming while your body gets to work breaking down the original one. But honestly, the most powerful tool we have is prevention. In the hospital, this is absolutely critical for patients who can't move around much. But for you, on a personal level, this is where you can take charge. Just being aware of your own risk factors, say on a long flight or after surgery, is the most important thing you can do to stay safe. And that really brings us to our final most important takeaway. For a condition that's so good at hiding, your single best defense is awareness. The biggest risk isn't actually having the risk factors, it's not knowing that you have them. So the real question is, are you listening to what your body is trying to tell you?